Our mission is to serve the underserved, uninsured, marginalized residents of our community. We serve everyone, immigrants and refugees, citizens of our community. We want to provide comprehensive health care for everyone within our community.
Every time that I've walked through the doors at PrimaryOne Health, the expectations were exceeded. You can just feel the compassion from every staff member.
The reason I chose to be a part of PrimaryOne Health is because of the mission of helping the underserved, and at the end of the day, I feel like I've done something really great. I feel like I've accomplished something, I've made a difference for someone's life, and for me, that's the best thing that we can do.
I was homeless and I developed an infection that led to an injury while I was on a construction site last August. And while I was in the hospital, I was introduced to people from Healthcare for the Homeless, PrimaryOne Health.
The reason why I joined PrimaryOne Health is simple. I believe in the mission. I believe in the cause to help identify and address healthcare disparities and to make sure that we provide quality care to all.
When I initially came for my first visit at PrimaryOne Health, it was a great experience. It wasn't what I had expected because there was a stigma related to coming to a community health center. However, the health care that I received was great.
One of the things that I love about working here is just that the team of providers really cares about our patients, and that patients will get treated with respect, they'll get treated with dignity, and they will get excellent quality health care.
What I do here is very, very rewarding to me. I feel like that I'm helping people that really need my help. People in private practice need help too, but the people that we see here may not get help anywhere else.
We know that those women and men who are facing disparities as it relates to social, cultural, and financial barriers, that we're working to address them. That's unique with PrimaryOne Health, and that's the reason why I've stayed for so long.
When I came into PrimaryOne Health, I was a teenager, and I originally came in for behavioral health services. Like many people, I had a very difficult childhood, and the counselor that I saw for actually several years was able to assist me in getting out of such a hard time in my life. And now I am in school to become a community health worker. And my ultimate goal is to become a social worker and help those in such a way that PrimaryOne helped me.
Oh, it makes me feel good to know that there's quality health care within our community. I've talked to a lot of people about the level of care I've received, about how the professionals at PrimaryOne Health have treated me, how they've treated others that I know, helping me to establish better habits in terms of nutrition and wellness, and making sure my meds are taken on time, and just having better habits. Having them in community has helped me a great deal, and I talk about them all the time.
The quality of care here at PrimaryOne Health has been really great. They were able to address my emotional well-being after the loss of my daughter, as well as healthcare issues that I had. The staff has always been great. My particular physician knows my needs. She's more like a friend, you know. She knows who I am. She knows when I'm not doing what I'm supposed to, and she addresses those issues.
There are so many stories of where I've been able to personally witness the transformation of a person through their vision. We had one little girl who could see nothing. She couldn't see the leaves on the tree or anything like that. Put the glasses on and she looked out the window and she was like, Mommy, look, you know, I can see the leaves, look at the carpet, the different things like that, the details that she had never seen. So we're just making her a success for the future in school.
As I travel through the community and talk to community residents, I'm always getting people who come up to me who talk about the services that they've received at one of our locations, or they talk about one of our clinicians. They talk about Dr. So-and-so that provided such great care. That helps me understand what's important to the people of our community and how well we're doing.
I joined the board of directors here at PrimaryOne Health because I wanted to be a voice for people who didn't have care. I wanted to be in that decision-making process, to expand services, to reach out to those who really needed health care. People who were like me that work hard 9 to 5 but didn't have health care benefits. Those who were working part-time and weren't offered health care. So I wanted to make sure that I was a part of that, the vision that PrimaryOne has to provide health care to people all over.
Everyone is respected and valued at PrimaryOne Health. So anyone who fits the bill, we would encourage them to come to PrimaryOne Health because we want to be the first choice for quality care in Ohio and in the nation.